Dandruff shampoo is used to treat dandruff and a certain scalp infection called seborrheic dermatitis. It helps reduce itching, flaking, irritation, and redness of the scalp. This shampoo contains selenium sulfide, which is also used for a condition that causes discoloration of the skin called tinea versicolor. It belongs to a class of medications called anti-infectives and works by slowing the growth of the yeast that causes the infection. Remember to use it as directed by your doctor for the best results. When using dandruff shampoo, it's important to follow the instructions on the product package. Wet your scalp, massage the shampoo onto the wet scalp, and leave it on for 2 to 3 minutes before rinsing thoroughly. Some brands may require a second application, so check the product package for details. Make sure to rinse your hair and scalp well with water after each application, especially if you have bleached, tinted, or permed hair. For the treatment of tinea versicolor, apply the shampoo to the affected skin, lather with a small amount of water, and allow it to remain on your skin for 10 minutes before rinsing thoroughly. If the medication touches the genital areas or skin folds, rinse the area well with water for a few minutes to prevent irritation. This medication is usually applied once daily for 7 days, or use as directed by your doctor. Be sure to wash your hands after using the shampoo, and do not leave it on your hair, scalp, or skin for a longer period or use it more often than directed. If your condition worsens or does not improve, be sure to tell your doctor or pharmacist promptly. Some potential side effects of using dandruff shampoo include skin irritation, dry skin, oily or dry hair/scalp, and temporary hair loss. If any of these effects persist or worsen, it's important to discontinue use and consult your doctor or pharmacist promptly. Hair discoloration may also occur, but this can be reduced by thoroughly rinsing the hair after each treatment. If your doctor has prescribed this shampoo, it's because they have determined that the benefits outweigh the potential risks. Many people using this shampoo do not experience serious side effects. However, if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using dandruff shampoo with selenium sulfide, make sure to inform your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that can cause allergic reactions. Also, let your pharmacist know about any existing skin conditions. This medication is not recommended for children under 2 years old, so it's important to consult your doctor before using it for younger children. If you are using dandruff shampoo with selenium sulfide for a skin condition called tinea versicolor during pregnancy, only use it if your doctor determines that the benefits outweigh the risks. It's also not clear if this medication passes into breast milk, so consult your doctor before using it while breastfeeding. When using dandruff shampoo, it's important to be aware of any potential drug interactions that may occur. Certain medications can affect how the shampoo works or increase the risk of experiencing side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as any herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without the approval of your doctor. This will help ensure the safe and effective use of dandruff shampoo. If this shampoo is accidentally ingested, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, call emergency services immediately. Otherwise, contact a poison control center for assistance. In the US, the number for the local poison control center is 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Be sure to keep all of your medical and laboratory appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use the dandruff shampoo at the scheduled time, use it as soon as you remember. If it's almost time for your next dose, skip the missed one and continue with the regular schedule. Do not use double the amount to make up for a missed dose. It's important to store dandruff shampoo at room temperature and avoid freezing it. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.